Good morning, everyone, and thank you for being here. My name is Maggie Royer. My pronouns are she, her, and I'm the Communications Senior Manager with Violence Free Minnesota. Today, we're releasing the 2023 Homicide Report, Relationship Abuse in Minnesota. This report honors and recognizes all 40 known victims of intimate partner homicide and domestic violence-related homicide in Minnesota in 2023. This press conference is set up as a Zoom webinar. After the speaker's remarks conclude, there will be time for questions from the media through the Q&A feature. Or if you are watching via the Facebook live stream, at the end of the speaker's remarks, you can submit questions in the Facebook comments. I wanted to uplift the fact that all 40 victims of intimate partner homicide last year should still be here today. Relationship abuse in our state is a social issue. It requires a social solution. It's really up to all of us as community members to address and respond to domestic violence. It's important to remember how the victims died, but more importantly, I want us to remember how they lived and who they were as people. Today, we have several speakers who represent agencies that work with communities who were significantly overrepresented in last year's homicide numbers and were uniquely impacted. This includes speakers from our Indigenous communities, older adults, and 2S LGBTQIA+ communities. Thank you, and I will now turn it over to Guadalupe Lopez, Executive Director of Violence Free Minnesota.
Bonjour, everyone. My name is Guadalupe Lopez. I'm the Executive Director of Violence Free Minnesota. I welcome you to our Homicide Memorial. As Maggie had shared, we have lost 40 community members in 2023. This is the highest number of documented since we began tracking in 1989. Even one death is too many, and it is all preventable. 80 adult and minor children lost parents last year. What does that do to a community? What does that do for families? What does that do for Minnesota? I also recognize that this isn't just a Minnesota issue, that this is a country issue, this is a global issue, and it is preventable. Relationship abuse exists 365 days a year and deserves appropriation, recognition, and attention. 11 bystanders and interveners were also killed last year. And this is a community issue, like Mickey had said, a public health issue, and we all have a role to play. We also need more funding to invest in domestic abuse transformation programming, so people who cause harm have a place to go to seek help and support. We need to prioritize community-based advocacy. To be an advocate is a special, passionate, heartfelt job for the community to interrupt violence, to also support people who are experiencing violence, and also to change social norms. It is a great job, and not everybody is called to do such work. So I want to give advocates a very big chimiquich for taking on that role as community helpers and supporters. We also need our policy recommendations to be taken up. In our report, you will see that we have multiple policy recommendations, media recommendations, and other recommendations for other priority areas. I also want to recognize that victims of color were overrepresented in 2023's homicide. Black, Native victims were at the highest. I want to bring to light the story of Darisha Tella Bailey Both. She was Forest Lake Area Community School student. An honorary cap and gown was also held in her honor, where she should have walked and graduated. She was a lover of animals, and when she graduated, she wanted to become a veterinarian. These are the stories that we want to share and the ways that people lived. We try to honor them within our report to bring light to love to their family, the ones that are grieving of the loss of the space at the table or at the house or at the job site or just in family and community in general. I also want to say thank you for everybody who helped support to write this report, to gather the information, and to bring love and light to the community members that we have lost. I would like to now introduce Juliette Rudy, the Director of the Missing and Murdered Indigenous Relatives Office.
Good morning, everyone. I'm Juliette Rudy, the Director of the Missing and Murdered Indigenous Relatives Office. American Indian women, girls, and Two-Spirit people are far more likely to experience violence, be murdered, or go missing more than any other demographic groups in Minnesota. The Minnesota Missing and Murdered Indigenous Relatives Office was created to address the disparity that exists for Indigenous people in Minnesota. At least 2 of the total 40 homicide victims in the Violence-Free Minnesota 2023 Intimate Partner Violence Report were Native. Native victims are often overrepresented in Minnesota's intimate partner violence homicide numbers. In this year's report, Violence-Free Minnesota added a new suspicious deaths criteria that is intended to capture information on suspicious deaths in Minnesota that are likely connected to domestic violence. Many intimate partner violence homicide cases of Native women are often not fully investigated or reported on equitably in the media. Women of color are often overrepresented in suspicious death cases, Violence-Free Minnesota tracks, and oftentimes their families have to pressure media and law enforcement into investigating fully. Although American Indian women and girls make up less than 1% of Minnesota's population, from 2010 through 2018, 8% of all murdered women and girls in Minnesota were American Indian. From 27 to 54 American Indian women and girls in Minnesota were missing in any given month from 2012 to 2020. Currently, there are a total of 62 Indigenous people missing in Minnesota. The MMIR office provided services in 2023 that address the disparity that exists for American Indian people. Our dedicated team includes a director, a community planner, a violence prevention coordinator, intelligence specialist, and victim specialist. The MMIR team has been actively addressing the mandates from the 2019 Missing and Murdered Indigenous Women's Task Force report. We provide case support and guide families during law enforcement investigations. We present educational lectures to youth, families, and the community. We bring awareness by developing and distributing missing persons materials. We make referrals, and we connect with victim service professionals, mental health services, support groups, and crime victim advocates. In 2023, we supported 23 law enforcement investigations and developed crucial missing persons materials. We launched a new communication plan and a web page to enhance our outreach. The MMIR Advisory Council and the Gagigay Mekwenda Goziwag Reward Fund Account Advisory Group were established, strengthening our community engagement and response. Our partnership with the Minnesota Department of Health's Safe Harbor program has been vital in combating human trafficking and addressing risk factors within Indigenous communities. We released a comprehensive report outlining best practices and strategies to end violence, violence epidemic affecting Indigenous people. This year, we introduced a specialty state license plate featuring a red handprint, symbolizing the ongoing struggle and resilience of Indigenous communities. $25 collected from each plate goes to the MMIR Reward Fund account to support Indigenous families and communities. Our work continues with a focus on prevention, education, and community collaboration to reduce disparities and eliminate injustice. We encourage continued support from stakeholders, coalitions, victims, advocates, and policymakers to sustain our efforts and drive meaningful change. Our vision is to reduce and end violence against all Indigenous people in Minnesota. It is now my pleasure to introduce our next speaker, Renee Strami, Communications and Training Manager, Minnesota Elder Justice Center. Thank you.
Thank you, Julie. Thank you to the Violence Free Minnesota for including the Minnesota Elder Justice Center. We are a statewide organization, and our mission is to prevent and alleviate abuse, neglect, and financial exploitation of older and vulnerable adults. We find that abuse and neglect and exploitation of older and vulnerable adults is an exercise in power and control, which is very similar to other forms of interpersonal violence. And I think it's very important that we keep that grounding involved in this exploration of homicides in this report. We find that elder abuse is most often, and not just we, this is the data, most often perpetrated by someone in an ongoing relationship with an expectation of trust. And typically that person is a family member, such as a spouse or adult child. But it's drastically underreported. For every incident of elder abuse that is reported, there are about 24 cases that do go undetected. We note that in our own work, we are an organization that does provide direct services, that at least in the last year, 83% of the perpetrators of abuse of those we served were somebody who was known to the victim, caregivers, family members, and 50% of those were really closely related to the victim. In this report, at least 15% of the homicides that were identified was somebody who was older than 50. We see when the instances of elder homicides occur, often there is a narrative around it that may not be reflective of the power and control that comes to play. We do see that it is power and control, but they can put it off as caregiver stress. Caregiving is stressful, but most caregivers do not abuse their family members or the person they're caring for. So it's important to keep that in mind, that elder abuse is indeed an exercise in power and control. We find that our position and our support here is that when we fail to recognize the prevalence of elder abuse, there is significant risk of increasing severity of the consequences of that abuse. That includes homicides. So we urge increased awareness and recognition of elder abuse and its intersection with other forms of maltreatment, so that we can both prevent and intervene more appropriately. We are grateful to be part of this discussion and to open up that dialogue more fully about how elder abuse and interpersonal violence are very closely related and have direct consequences for older adults. And so with that, I am going to turn it over to Roan. Okay, oh, now I just lost her first name. I'm so sorry, you guys. Kat Roan, I wanted to say Kay, who's the executive director of Outfront Minnesota, and I believe Maggie has a pre-recorded video from her.
Thank you so much, Renee. I will go ahead and share my screen and we'll have a video from Kat. Just allow me a moment, please.
Is Roan. I use they and she pronouns, and I serve as executive director for Outfront Minnesota, our state's largest LGBTQ advocacy organization, which has been serving Minnesota since 1987. I'm sorry that I can't be with you all today. I am in travel to a conference, but I want to thank my partners at Violence Free Minnesota for inviting me to share this video and to speak about our community. Our organization runs an anti-violence program which serves LGBTQ victims and survivors of discrimination and violence, including those who have experienced intimate partner violence, and we advocate along with our partners for an end to violence here in the state and for wholeness and safety and well-being for all of our LGBTQ communities. Today, I want to take a moment to remember Daniel Joseph Aldridge and Savannah Ryan Williams. We lost each of them too soon, and my heart goes out to their families, their friends, and all of those in community who were affected by each of their losses. Unfortunately, violence against LGBTQ communities continues to rise. This is especially true for transgender and gender expansive individuals, particularly those who are also BIPOC individuals and share those multiple identities. Our communities unfortunately still face situations where lack of supportive family structures, lack of supportive social environments can compound social harms and create additional risk or lack of access to care and services that may help those who are at risk of intimate partner violence. And unfortunately, for many members of our community, access to supportive services remains out of reach. Shelters and service providers, even here in our state where we have strong policies and protections, can sometimes be places of harm and unfortunately still turn away members of the LGBTQ community or serve them in ways that are not helpful or not affirming of their identities. Our state needs to do more to ensure that we have fully inclusive services, culturally competent professionals and providers, and the resources needed to support our community's diverse needs. And each of us, as individuals, whether in professional roles and in our personal lives, has a role to play in speaking out against violence, against homophobia, transphobia, and all of the harm that it causes to our communities. I want to take this time to thank Violence Free Minnesota and all of the partners who are joining this conversation today for their part in that work. Together, Minnesota continues to make progress in these spaces, both advancing important policies that help to support our communities and taking the time to have conversations through training programs, through community work, through public events and conversations like this one to ensure that we have a better understanding of the many diverse communities that are impacted by violence here in this state. I am heartened by the work being done and heartened by the ways in which our communities have come together in the face of tragedy to give one another care, to hold space for those we have lost, and to move our state and this work forward. That gives me hope.
I want to thank Juliet, Renee, and Kat, and Maggie, and everyone who helped with our 2023 homicide report. I have been in advocacy since 2004, doing coalition work, and my goal is to work myself out of a job. And I know that we are in what the speakers had shared, heartfelt dedication and passion for prevention and support for our community members. I also want to say a big thank you, a Chimigwich, to survivors who are come join this movement, who are doing whatever they can to live their best lives and to know that there is help and support out there. I also want to say thank you to the family members that do not give up on their families, members and community members who are surviving the violence. It can be a very lonely place to be surviving violence, especially when you do not have community or family. I also just want to say that and reiterate again that every person in this report and reports in the past, all of their deaths were preventable. And how important that is for us to understand of how we should be moving together as Minnesotans, how we should be moving together as being better relatives to each other. We are all interconnected, whether we believe it or not. One life loss is too many. I also want to say thank you for everybody who shows up with love and compassion in all of the different ways and professions that survivors end up meeting along the way of their lives. And with that, I think I will close our end of the press conference and open it up for question and answers if there are any. Miigwech.
So I'm seeing a question in the chat. Thank you, Mara. The question says, it looks like many more bystanders were killed than in past years. Do you have insight or information into why that was? So, like Guadalupe mentioned, there were 11 bystanders and interveners killed last year. I can't speak to why that number might be higher. I would guess that because we had a larger number of homicides overall last year with 40 victims, that there was kind of an associated greater number of bystanders and interveners. But I can't speak to a specific reason why that number was higher. We did also, for the first time, look at the cause of death for bystanders and interveners last year overall. And we found that the vast majority of bystanders and interveners were killed using a firearm. And that's been fairly common throughout the past decade or so. Thank you for that question. I'm also seeing a note in the chat that the Facebook live stream is a couple seconds behind. So we'll just continue waiting a little bit to see if anybody on the Facebook also has questions. Okay, I'm seeing a couple more questions. One question asks, are there still cases where information is not yet confirmed that could be added later? That's a great question. I would say almost every single year we track cases throughout the year where we don't necessarily have enough information to confirm them. We aren't currently tracking any cases from 2023 that we couldn't confirm. So I can say that we don't have any cases from 2023 that we have not confirmed. But every single year, because we rely primarily on media sources, if the media is not reporting on a homicide, we might not be able to confirm that homicide. I think, like Julie Rudy mentioned, this is very common for homicides of women of color. And sometimes we have homicides where we're just not able to confirm the relationship between the victim and the alleged perpetrator. I'm seeing another question from the Pioneer Press. Do we have specific policy asks or recommendations that we'll be seeking in the upcoming legislative session or otherwise? We do have our policy program manager on the call. So Jess, I'm not sure if you wanted to answer that question.
Sure, I'm happy to answer that. Hi, my name is Jess Palian. I am the Policy Program Manager at Violence Free Minnesota. And the question being, do we have any specific policy asks that we might bring in the upcoming legislative session to address some of these issues? Yes, I think the biggest one is funding for crime victim services. So as many people know, the nonprofit sector is struggling right now. Ever since COVID, there's been a drop in charitable giving. And that's compounded by the fact that there's been a drop in federal funding to crime victim services. We're facing some serious cuts in that regard due to a pretty complicated series of decisions that have been made years ago at this point and not been fixed. So one of the biggest thing we can do is fund that network of community-based advocacy and community-based shelter that is keeping people safe and giving them the flexibility to go where they need to go and be able to make the decisions that they need to make in order to be safe. Beyond that, we're also hoping to bring the Survivors Justice Act, which would allow for sentencing flexibility when survivors of violence themselves commit crimes. We know that survivors of domestic violence oftentimes commit crimes of survival, or they use violence themselves to defend themselves from their abuser. And so trying to make sure that the full context of what happened to them before they made the decisions that they made uh, can be considered by a judge before a sentence is imposed is really important to making sure that people can keep themselves safe by whatever means is necessary to keep them safe. So those are the two big ones I wanted to highlight right now. But I do want to underscore again, if there's one thing you're going to take away from this, it's that funding that crime victim services ecosystem that we have and making sure that there are resources to be given to survivors is one of the most important things we can do, because the idea is we want to get people in the system and we want to get people accessing help months and years before anything escalates to a homicide level. We want to make sure people are able to make decisions for themselves and operate with full agency in the world far before their life is threatened. So I think that's my answer to your question. If you have anything else, please let me know.
Thank you so much for that, Jess. I'm seeing another question asking, was there any other thing about the data that stood out to you about this past year? So I would say this doesn't stand out to me because it's consistent nearly every single year. But again, the vast majority of homicides of victims who were killed by a current or former partner involved a firearm. So in 2023, 16 of the 29 people who were killed by a partner were killed using a firearm. So that's about 55%. And in some of these cases, the perpetrator was legally prohibited from possessing a firearm. So I think it's really important to continue bringing attention to that. And we also really need to be asking the question of, why does this keep happening? Why are firearm-related homicides so common? And why do we have these situations where someone should not have access to firearm, but they end up killing their partner with one? So we really need to be looking at kind of the gaps in the system that are leading to this issue. I have another question. I think, Jess, this might be a question for you. Do we feel that prevention efforts would help reduce domestic violence? Does the state fund prevention efforts? You're muted.
Sorry about that. Thank you, Maggie. I think this is a good question, and I think it's really important to talk about. You'll notice at one point in our homicide report, we talk about how in healthcare settings, we need to integrate the ability to screen for DV throughout the workflow of a hospital. So everybody needs to know what they would look for at their station to try and notice when domestic violence might be occurring in a patient. And I think that's a good microcosm of how we can look at prevention throughout the whole community. So through a combination of education and activation, that is, people need to know what to look for, and then they need to know what to do when they see somebody in a dangerous situation. I think that is a really important piece to preventing violence in the community. It's also important to note that a lot of our programs are currently strapped for resources to just deal with the crises, with the problems that already occurred. So the state does fund some prevention, but it is important to note that while prevention and the whole an ounce of prevention is worth a pound of cure, there's still a lot of people who are in that crisis situation. And it's really hard to allocate funds towards prevention when you have people actively going through crisis. So while it is true that there is prevention dollars and we would love more of them, we would love to invest in that system as much as we can. It's also true that in an area of limited resources, we need to make sure that we're allocating the money to minimize whatever harm we can. And that's a calculus that's made kind of on an individual program level, because our programs know better than us that what their specific community needs to be safe. So yes, prevention is huge, and part of that is a huge culture shift where everybody is starting to learn more about how they can be safe, how a healthy relationship looks and doesn't look. And then at the same time, just need to stress again that a lot of our programs are kind of forced into doing more crisis work than they would prefer because of resource shortage.
Correct. I also wanted to add, in October of 2023, Violence Free Minnesota released an Intimate Partner Homicide During Pregnancy in Minnesota report, where we took a 10-year gap or data collection and wrote a report on people who were murdered while pregnant. And again, the rates of Black and Indigenous and people of color were higher than our white-bodied relatives in that report. Also, I think, it has us supporting pregnant people supporting them while giving birth and maternity is very important. And I know that there was some policy passed just this year for specific services for Black and Indigenous birthing centers. And so I think the more people we get in to understanding how domestic violence impacts and interweaves with all of the different sectors, and we work together, I think that is in a different part of prevention: housing, healthcare, of course, like with the policy that we're holding, but also in different ways of, like Jess said, of making sure that we are changing societal norms and shifting culture.
I wanted to kind of wrap in this idea of this discussion about prevention and options and lean into a little bit of what Jess had said about prevention in healthcare settings. And I want to add that layer of complication that comes into play as an older adult maybe has somebody taking control of even their healthcare. And it's important, like a simple act of prevention, ensure that the older adult gets to speak for themselves. Some people will say, well, she or he has some cognitive issues, and so I need to be here and I have to say things. But cognition is a gray area, and there's opportunities for that person to speak for themselves and know that, sometimes that is used as a wall to keep and isolate a victim of violence, of elder abuse. So I really lean into those added complications for older adults who it's very similar. We need more healthcare education about prevention and screening in this way. I think there's a lot of information out there to illustrate that isolation is one of the biggest risk factors for older adults. And the way we can prevent that is more community engagement and more community involvement so that people are not isolated and subject to that abuse. So thank you for allowing me the opportunity to just add that info on top of this.
Thank you so much, Renee. I'm seeing a question from Charles that says, are there similar reports that come out of other states? Do we know how the Minnesota domestic violence homicide rate compares to other states? So there are other state domestic violence coalitions that do release an intimate partner homicide report annually, similar to Violence Free Minnesota. Not every state does this. Some states do this through a fatality review process. We don't do that at Violence Free Minnesota. I do know that last year in Illinois, they recorded a 110% spike in domestic violence homicides in Illinois between 2022 and 2023. So that's a very significant increase. I really also want to kind of tie that back to what Guadalupe mentioned at the beginning of the press conference, that we are still seeing the after effects of the pandemic. We do not live in a post-pandemic world. Advocates have been very vocal about the fact that they were seeing increased levels of violence severity during the pandemic. Some advocacy programs were reporting greater numbers of contacts to their programs. And yet, despite all of this, we're not seeing a proportionate investment in funding and recognition for advocacy services in our state. So that's really a critical piece of prevention as well. I'm also seeing a question about firearms. Jess, you might be able to speak to this. What recommendations do we have, if any, regarding access to firearms for those that are prohibited from possessing them?
Yeah, thanks, Maggie. So the first thing that comes to mind is to make sure that we're enforcing the law already on the books regarding extreme risk protection orders. So those are orders that can effectively disarm somebody who's using harm if a court so orders it. Those were put into law, I believe, last year, and we just want to make sure that those are being fully implemented and that when an extreme risk protection order goes out, that person is actually getting that person's actually having that issue addressed and having their firearms turned over. There's also currently a task force mandated by state statute that is trying to address domestic violence and firearms and kind of how they overlap and the best way to make sure that those sort of extreme risk situations are addressed appropriately. So that is something that is currently going on behind the scenes, and we're excited to see what kind of recommendations come out of that. We do have a seat on that task force. Another important thing that is in our report that I want people to know about is that we are really hoping for some supply side gun violence prevention legislation. It is important to note that while every single time that somebody uses a firearm to cause violence, that itself is a tragedy, it's also important to note that oftentimes the guns that are going to people who shouldn't have them are coming from a single source or a small collection of sources. And it's much more efficient and effective to try and go after the sources of those guns who are getting inappropriately into people's hands than it is to go after each individual person. And so making sure that we address things on that supply side, we can possibly have a bigger impact on the amount of guns that are getting into hands that shouldn't have them. Beyond that, we need to be thinking about what guns legally can be obtained. In truth, for domestic violence, any gun is a danger, but it should be noted that a lot of the domestic violence homicide that we see is not from someone who's prohibited from owning a firearm. It's just from someone who's misusing a firearm. So it's really important for us to note that we need to really be rethinking as a society who gets access to firearms, what firearms can they have, and what is the impact of just allowing firearms to continue remaining in homes where we know that they are often used against people that live inside those very same homes.
Thank you, Jess. I'm seeing a question from Mara in the Q&A that's asking about, so at the memorial, we had initially seen in February, excuse me, there were 39 victims noted at that time. Did research or a cause of death determination add one victim to get to 40? Thank you for asking that. So we did add a 40th victim of domestic violence related homicide to our numbers. So the total is 40 victims for last year. We had that victim's family member reached out to our coalition and notified us about her family member's death. He was killed while intervening in a domestic violence incident. He was attempting to protect a woman from being assaulted by her partner, and unfortunately, he was killed during that incident. So he is included as the 40th victim in this report. As I mentioned, we rely really heavily on media coverage for our domestic violence homicide numbers. So sometimes we do have victims' loved ones reaching out to us and notifying us about homicides. Thank you. I am not seeing, okay, I'm seeing another policy question. Jess, I saw that California passed a law to investigate suspicious deaths when there is a history of domestic violence. Will Minnesota be active on this issue?
Yeah, thank you for that. So one thing I can say for sure is that our coalition is active in the issue. We are looking more into suspicious deaths, and we are trying to highlight suspicious deaths that we can't necessarily confirm as domestic violence homicide, but certainly have some of the markers of it in our reports going forward. So that's something for sure on a coalition level we are willing to address. On a statewide legislature level, I can't speak for the legislature. It's something that I think we would certainly support is looking into suspicious deaths and having a process by which the people who knew the victim best can get those deaths better investigated. I think that we already have some pioneering progress in those fields with the Missing and Murdered Indigenous Office and the Missing and Murdered African Women and Girls Office. I think both of those do a little bit of work that is in the same vein as the suspicious deaths law in California, but the California law, for those who are unaware, it allows basically a whole office to open up investigations into deaths that were not proclaimed homicides, but that the family of the victim thinks may have been a homicide. That's a really broad oversimplification of it, but it's expected to be a pretty good way to make sure that families who don't believe that a suicide happened, for example, and that think maybe that DV homicide was involved, can maybe get that investigation reopened. So I just want to say that it's brand new and it's an interesting approach that I think we would certainly be supportive exploring. But I don't know anything about the Minnesota legislature considering it at this point. They could be. I legitimately don't have that much guidance on it.
If it's okay, I'd like to comment on the Missing and Murdered Indigenous Relatives Task Force statute, or Missing and Murdered Indigenous Relatives statute. Our office has been given authority to look at suspicious deaths, in particular suicide and overdose deaths of Indigenous people in Minnesota. I can say that we've worked on a few cases where families feel like domestic violence was involved. And so assisting families through that law enforcement investigation is critical to helping them find answers and helping them understand autopsy reports. So we have a limited authority to help with that, but we do it, in particular with suicide and overdose cases. But like I said, a lot of times the family feel like that domestic violence was a part of the situation. So we help them with meet with law enforcement and medical examiners to go over the case.
Thank you so much, Julie. I'm seeing a couple more questions in the chat. We have about 15 minutes left here. One question is asking, domestic violence deaths that the attorney's office has not picked up, are those included in last year's? I believe asking, are those included in last year's numbers? So we, in our suspicious deaths section of the report, the 2023 report, we are including information about a suspicious death. The victim was 93. She had died at home and her husband was present. We did not have sufficient information to determine whether he had killed her intentionally, and we weren't quite sure about what had actually happened throughout that process. And he is not scheduled to go to trial until 2025, at which point we believe more information will be released. So that is a suspicious death that we are tracking that's included in the 2023 report. And we are hoping that more information about that person will be released in 2025. I'm also seeing part of that question is asking, what is the process to get past domestic violence charges actually charged within the Minneapolis Police Department? I just wanted to open that up to see if anybody from our panelists had a response to that.
I can just highlight really quick, one of our member programs, Global Rights for Women, has an amazing overview of the gender disparities that have been seen both within the Minneapolis Police Department and also within their treatment of the community. I recommend everybody take a read of that. The issue of domestic violence cases not getting recommended up for charging at the police level or at the attorney level, it is active in Minneapolis, and it's also active far beyond Minneapolis. There is, both in the general culture and in police culture specifically, there is oftentimes a mistrust of victims when they do tell their stories, and that is sometimes amplified when that victim is now deceased and cannot tell their story. And so there are, I would say, I guess, I would recommend you read the Global Rights for Women report and its recommendations. But B, I would also just recommend that one of the most important policy, cultural issues that we can start with is just believing victims when they tell you what's happening to them. Starting from that baseline of belief and making sure that you are listening fully to what they're saying, and then applying that to the case put in front of you. And I know that that's incredibly general. Ultimately, though, we do need to it's a cultural shift that needs to happen, because we need to make sure that those in the legal system are using their discretion appropriately, as opposed to using their discretion to just screen out cases that end up in homicide.
Thank you, Jess. There's another question asking, has there been an uptick in violence against individuals who identify as he, him? So I can't speak to whether there's been an uptick in domestic violence against male victims. However, I can say that in 2023, we found that there were at least 3 domestic violence homicides of male victims who were killed by a current or former intimate partner. Their names were Manuel, Logan, and Daniel. Daniel was killed by his male partner, and then Manuel and Logan were killed by female partners. So we do have a section in the 2023 report that kind of talks a little more deeply about some of these barriers that male victims of domestic violence might face. I think for some male victims, it might be really difficult to come forward, especially when they're being abused by a female partner, because there's all these social norms that really kind of inform men that they should kind of restrict their emotions and they should not be open about their feelings. So we did have one of the male victims last year, his friend had reported that he had witnessed the victim's girlfriend repeatedly hitting him during arguments. So that's really something we wanted to note, that it's important that we're recognizing those unique barriers that male victims might face. It also might be more difficult for us to accurately track victims of domestic violence homicide who were male, because again, there can be some of that lack of awareness in media coverage. There may not be as equitable of media coverage focused on male victims as perhaps cisgender female victims. Thank you for that question. So we have about 10 minutes left. I'm not seeing any more questions at this time. Just wanted to leave it open for about 30 more seconds and then we can close. Okay, I'm seeing Facebook is quiet. I'm not seeing any more questions here. I just wanted to thank everyone so much for attending today and really making sure that we're paying awareness to this issue and that we're memorializing all of the 40 victims. And then I just wanted to say an enormous thank you to Julie Rudy, Renee Strummy, Kat Roan, and Guadalupe. Thank you so much for being speakers today. Really appreciate your time. I'll turn it over to Guadalupe.
Thank you. And yes, thank you again for everyone who joined live streaming, asked important questions and keeping this dialogue going. I appreciate you. And I appreciate again all of the partners and the intern that helped for the this current report that we are going to be releasing next year. We have a memorial this coming winter. And so stay tuned for those dates and that's open to the public. And I just want to say Chimiquich and thank you for all you do. And we will see you again.